I am really thrilled to bring back Dr. Thomas Levy. We have a huge announcement to make today. And so start texting and calling and making sure that everybody who wants to promote health within themselves is ready to learn and grow with Dr. Thomas Levy. And so I am going to go ahead and start the recording. And as you guys know, when we're dancing, I'm also trying to open up screens and doing all this stuff. So we're going to be, so while we're doing all of that, make sure that we are good to go. Okay. So let me just delete some of these things. I got a little distracted talking to Dr. Thomas Levy today. So I'm going to start the record. Now, many of you have heard of Dr. Thomas Levy through many different directions, different ways, but when I got a hold of Dr. Thomas Levy, I was just really excited because he's taught us a lot about many things. And we're going to, I hear my chime here. I am going to go ahead and get you guys started. Make sure that you text, tag, and do everything you possibly can to get as many people listening to what Dr. Thomas Levy, MDJD, has to say. So fasten your seatbelt. It's time to get in the moment and learn, grow, and let's dance. Here we go.
The Lillian McDermott Show.
We love, we fear, bridges we burn, we make mistakes, then we live and learn. When life gets tough, and it seems like your best ain't good enough. If you're in need of hope, you know where I'll be right here, right here. And when you need a friend, you can count on me. I'll be right here, waiting for
you. This is the place you can always turn to when you need a friend. The Lillian McDermott Show. To reach out to Lillian, visit her on the web at whenyouneedafriend.com. Now let's all learn together. Here's Lillian McDermott.
Hello, my listening and viewing friend. It's so nice we can meet each other on the air on this beautiful, best day ever. And for those of you who are tuning into the classroom for the first time, please know I've been waiting for you. This is a safe place where you can go to when you need a friend. It is my commitment to provide alternative ways to heal, and it is my mission to make awareness, responsibility, and truth a part of our everyday life. And I hope you, my listening, as well as my viewing friend, will feel empowered, embracing the new truth, and so that you can live the life of your dreams. Now, as you know, I love it when Dr. Thomas Levy is in the classroom, because not only did we hear about the powers and the miracles of vitamin C, we heard about, oh my gosh, hydrogen peroxide and nebulizing hydrogen peroxide and the many uses of hydrogen peroxide. And then he came on again and he talked about the hidden epidemic, which is the mouth. And I'm thinking, there's just so much information stored into this one human being that we need to share it. We need to get everybody excited about being proactive about their life. And we've got a huge announcement to make later on. But before we continue, I want to continue with Dr. Levy and helping understand how can we achieve and how can we get back to the health that we believe is out there for us. You know, many of us don't know that you can feel better. They're going around feeling sick, thinking that's normal. But how about if you could have a roadmap back to health? Would you take it? Would you go in that direction? Would you try to find that destination to see what's at the end? Well, Dr. Thomas Levy, MD, JD, is here to give us those little tips and more. And since it is our sole purpose in life to give and receive love and knowledge, I am so grateful that Dr. Levy is here to do just that. Welcome back, Dr. Levy.
Hi, Lily. Good to be here. I got to say this. You mentioned in your intro an alternative way to heal. Mm-hmm. Not really. This is what we're going to talk about is the only proper way to heal.
Yes.
What regular medicine does, quite honestly, makes no routine attempt to heal. They make an attempt to deal with symptoms, so your headache goes away or your arthritis feels better.
Yep.
And what they do does nothing at all to address why you got that headache, why you got that joint pain. So what we're talking about is scientifically based and established knowledge, not necessarily appreciated by that many people, but scientifically established nevertheless, ways to address why you have a given disease or condition, try to address how you can stop provoking that disease so that it gets worse, and ways that you can actually stop the disease, and depending on how thoroughly you address the causes, sometimes reverse and sometimes cure diseases that are not routinely addressed in this fashion.
Absolutely. And I totally agree with you. Where I'm coming from, and not to defend it, I'm just trying to explain it. Where I'm coming from is so many of us believe that allopathic is the only way.
Right.
And they'll go from doctor to doctor, from pill to pill, trying to find their alternative. And so their cure, their golden egg. But the reality is that there are alternatives from that. And I just want them to look in that direction. You know, Dr. Lorraine Day also says that. And I totally respect and I totally get, because to me, there's only one way to help, only one way to help. But for someone who is in the white coat trance, like I hear and obey. And I told you just recently, 3 months ago, I was told that I needed my gallbladder out. And, you know, I could have been in that white coat trance, scheduled the appointment, scheduled the surgery, and then out would have come my gallbladder. And even people were saying to me, people that I love were saying to me, that's ridiculous. You need to have your gallbladder out. And peer pressure to do what the white coat told me to do. But there's nothing that beats natural, holistic, alternative. And it should be the first round that we should choose for. With a headache, drink water, you know, de-stress your life. Those are the things. So when I do say alternative, I mean looking outside what you think is the only way. And so, does that make sense?
Yeah, no, absolutely.
Yeah. So but that mindset.
It's just that using the term alternative, and I understand what you're saying.
Yeah.
Implies that what you're doing the alternative to is a legitimate way of really doing things. And in fact of the matter is, quote unquote, modern medicine is not making you better. If you take the perfect combination of prescription drugs for the perfectly appropriate situation, you may symptomatically feel better, while whatever condition you have rages on and progresses and eventually develop other things. So there's just very few things I'm willing to give quote unquote modern medicine credit for anymore, other than certain specific surgeries, trauma, certain eye care, this, that, or the other. But when you're getting down to chronic medical diseases and seeing your family practitioner or internal medicine doctor, or even your cardiologist, as we've discussed, either deliberately or by ignoring things, they are collectively clueless about some basic concepts, which we'll talk about in a moment, as to why you get sick.
Absolutely. And it makes so much, it didn't make sense to me until it happened to me. Like once I was challenged on my show to do something different. It was eat raw vegan for 1 month. That was it. I know to some people they would go like, that's ridiculous. But what I discovered about myself, Dr. Levy, is that in 4 days, I felt so good, but I didn't feel bad. I didn't know I could feel better. And the question I asked was, what else did they lie to me about? And, you know, my registered service mark is you can take a pill or you can take responsibility. And it's not that I'm against the pill, it's that I'm for taking these steps so that we can get on the road and the right path to recovery or to optimal health, which is your goal. And so let's talk about your road. Okay, go ahead.
As we've discussed in the past, what you did inadvertently, but it's a good demonstration, was taking those measures, you developed for yourself a new health intuition. You had a better realization. A lot of people think that just because they're not having a headache or their joints are not hurting and they did the day before, that they're feeling good. Well, maybe, but more often than not, no. Once you get beyond dealing with chronic symptoms, there are so many levels of additional health. It's hard to understand until you do something that truly promotes health in your body, and you have a clarity of thought, you have a clarity of vision, you have a little extra energy that you never had before.
Yeah.
You notice that you walk across the room more quickly. Well, why did you walk across the room more quickly? Well, because you wanted to, and you had the energy, and you weren't pushing. You just developed. And this is why, and we've talked about this too, once you've done the things so that you improve your health intuition, then it's so much easier through trial and error to see the things that support that, to see the things that compromise that, to see for yourself what your best supplemental regimen is or diet. And as you noted, I mean, I don't know whether you want to go on a vegan diet indefinitely, but it definitely showed you that not so much just eating vegetables did it, as it eliminated other things that you didn't realize that were toxic or promoted poor digestion, which gave that. The worst thing about diets and toxicity is the things that promote poor digestion. Poor digestion generates more toxicity than any suboptimal choice of foods that you can have. I always like to say a diet of McDonald's perfectly digested gives you far less toxicity than the perfect organic diet with poor food combinations, poorly digested, and still allowing the proliferation of an abnormal microbiome in your gut and the generation of a lot of gut toxins. So the real thing you need, most importantly in nutrition, is whatever it takes for you to have optimal digestion, which means the gut clearing out no more than every 12 to 18 hours, and usually or less, which usually means at least 2 bowel movements a day.
Yeah. Okay. So I love that. I love that. I'm having like so many questions with the comparison of McDonald's properly digested, which we know is not food, versus something that is raw, vegan, organic, that is improperly digested. I would like to, I need to take some time, and I think we could do an entire class on that one, but I need to kind of like compartmentalize it, because how can the body process non-food? Like did you hear about that McDonald's? They found this McDonald's burger that was left in a coat, 10 years or so, and it was like totally intact. The bread was intact, the burger was intact, the cheese, it was like preserved. So,
well, I guess the fact of the matter is maybe the McDonald's is a bad example because
okay. I didn't know you were giving me
because
facts.
they have intrinsically poor food combination.
Okay.
One of the most common reasons for a sluggish gut that gets toxic is the improper food combination. And the most common but improper food combination is carbohydrate and protein. And what's that? That's a hamburger. That's bread and meat. Okay, we love our bread. That's fine. We love our meat, but they don't go together. And I'll just add to that. This was demonstrated in the early part of the 19th century by the Nobel Prize winner, Dr. Ivan Pavlov, who did a lot of digestive physiology research. He found that when he put carbohydrate, just pure carbohydrate bread in the stomach of a dog, it took 60 to 90 minutes to be processed and then move out of the stomach across the pylorus into the gut. When he put in ground meat chips, which is the ultimate in a protein dish, it took 3 hours to move and to be processed. Then he put the two together. He put the carbohydrate and the meat chips together, and it took 8 to 9 hours for the stomach to empty.
Whoa. Okay.
Now,
So
you need to remember that the digestive system is a continuous tube. So if you're not moving stuff out of your stomach, you're not moving stuff anywhere else in the gut. When one part moves, the other part moves. One part cannot move rapidly while the other stands still. And if one part stands still, the distal part cannot move rapidly. So you need to do the things that keep it going.
So what I'm hearing you say, let's use an example that I can digest, is nuts and seeds with greens, or potato with tempeh, for example, or nuts, or nut butter, or something like that. Would that be something that would be doable?
Well, without getting too deep into the weeds on food combination, nuts are problematic in and of themselves because in their own constitution, they're a poor combination. Okay. Peanuts are really tough to digest well. And it depends on the seed. I don't have a, encyclopedic knowledge of what's in every seed or what's in every nut, but there are certainly a lot of nuts that are much more easily digested, and you know it intuitively when you have a snack at night. If I have a snack on, say, peanuts at night, personally, I belch it the rest of the night. If I have a little snack of cashews, no problem. So I mean, there are differences. And like I said, I don't have an encyclopedic knowledge, but you need to be attuned. Whatever you choose, how does your digestion feel? You have a comfortable stomach, you have an acid stomach, are you burping, are you belching? All of these that you shouldn't have any of that. Okay. And so, but some nutritionists, using the word liberally, kind of seem to think that food combining is just some sort of voodoo. Well, I tell you, there's nothing more scientific with regard to digestion than following these food combinations correctly. The only thing I would add is, when you're a young person, you eat anything you want. Okay, your stomach feels fine, you go to bed, you sleep 9 hours and you get up. Okay. For whatever reason, we lose a lot of that ability as we get older. We make less digestive enzymes, a lot of different things take place. But bottom line is, if you're serious about good digestion and you're not getting satisfaction with whatever protocol you're following, get a good food combining book and follow those principles. And the thing is you can still eat the same food you want, but you just got to break out of the traditional combinations. You got to have like in the Latin American countries, they have, fruit for breakfast. That's a good idea. Nice, simple, digest rapidly, passes through your system, and your stomach is more than empty and ready for lunch. The thing is if you want to have potatoes in some form, well, you got to break out of combining it. Have the potatoes in a little dish by itself, and then your next meal, have your meat or whatever heavy protein you want by itself. You just got to break out of the mold. And unfortunately, the way our culture runs is, you go to a restaurant, your favorite restaurant. I mean, 9 out of 10 of your favorite dishes have poor food combinations in them. And if you start to identify this and start to realize it and just break out of the mindset and habit that you have to eat certain things together, you'll be amazed at how well you digest. And of course, as you well realize, when you start digesting correctly, you get health benefits throughout the body.
So rice and beans, because I grew up with rice and beans, being Spanish, rice and bean, that's a good combination because you got the protein of the bean and the starch of or is that a carb?
No, you don't want protein and starch together. That's the classical.
Oh, you don't? Oh, I thought you said that when you gave the dog carbs and it took 90 minutes, but when you gave it meat, it gave 3 hours, but then you put the carb and the meat together and it was 8 hours.
Yes, but you want food to process rapidly. You don't want it to take, I mean,
You just,
what
okay,
that's talking
I
about.
misheard. I misheard.
Okay, what that happens is rice and beans. Let's take that as an example. You have that as a dinner or late at night, you can still have it in your stomach the next morning. Okay, you want things to proceed through quickly, not in a diarrhea-like fashion, but just it proceeds because of normal digestion. For whatever reason, and now I can't give you the physiological reason, what reflex is taking place in the gut, et cetera, but when you put starch and protein together, it just slows the digestion down to a crawl.
Okay.
But most people eat that way. Latin America eats that way. And what do most people have? You know, they have gas, they have belching, they have constipation, they have diarrhea, and you go to and they just think, well, I just need to take a little
Pepto-Bismol. Yeah.
take a little. I mean, I'm not going to avoid my perfect favorite food combination. So, well, that's fine. And that's the way you want to manage it, fine. But this advice is important for people who have gotten to the point where they think there's nothing that can be done about these abnormal digestive symptoms. The answer is there's a lot that can be done, but it takes changing the way you approach eating.
Well, I want to learn more about this food combination. We just had Anna Maria and Bryant Clement in the classroom, and that was our specifically. I need to go back and relearn what they were talking about as well, and do a little bit more research. And maybe we can even do a class on this. And I know all of you have questions for Dr. Levy. If you have any questions for Dr. Levy, type in a Q. Write down your question, because that's what stops me when we do the Teacher's Pet Corner and I check out to see if you have your cue. So ask your questions and then we'll get to it towards the end. So okay. So how would you eat rice and beans so that it gets processed and digested? Let's just use that, for example.
Well, there's no way that I know of to support optimal digestion by eating them together.
Correct. Okay.
Again, that's not to say that you should or shouldn't do it. It's just saying that
that's what's causing
a lot
the gas.
of the way we eat is based on culture. It's not based on science. Now let's go back to the Stone Age.
Yes.
You know, the caveman. I mean, they ate mono meals.
Mm-hmm.
You know, they had some vegetable they harvested, that's what they ate. They killed an animal, that's what they ate. They have something else, that's what they ate. They have some fruit, that's what they ate. They didn't have a refrigerator, and so they never ate 2 or 3 or 4 things together. Okay, so that's what I'm saying is our culture has pushed us to these wrong combinations, and you grow up with something you love and you just can't conceive of not eating it. And I'm not telling anybody not to eat rice and beans. I love them myself, one of my favorite dishes. I also have a lot of digestive problems. So I'm sitting here, you know, which one do I want to give up? My digestive problems or my favorite combinations? I'm just saying there are options out there. If you feel you've gotten to the point where there's no way you can decrease your digestive symptoms, and you're just resigned to that, and it's especially distressing to you. Some people, it's not distressing to have a little momentary acidic stomach, or take a Pepto-Bismol, a Maalox, sodium bicarbonate, you name it. But let me tell you, like I said, as you get older, the amount of negative impact poorly digested food has on you just magnifies all the things that we're talking about, you know, all the things why, well, when you absorb a lot of toxins from poorly digested food, an abnormal microbiome, and your arthritis flares up the next day, and all you do is take an anti-arthritic medication for it to make the pain go away, well, all you've done is just cover over what's causing your problem, and you're not addressing it. So again, everybody needs to decide for themselves, how good do I want my health? What's the degree of discipline and sacrifice I want to make to reach that? and then you reach your own decision. I mean, you grow up with your favorite foods and favorite combinations, and you have no intention of giving them up. That's fine. I just want to make it clear that there are options that will improve your digestion dramatically if you're motivated enough and disciplined enough to take them.
I love it. I love it. It's just giving me, I'm going all
And
over
in a
the place
nutshell,
as
the best thing too is the caveman eat. Mono meal.
mono
Okay.
meal.
You
And,
know?
and I believe that that is also what Anna Maria and Brian Clements said. So we need to keep with the like foods and have that meal. It is just, it's almost the worst part of changing my lifestyle was the lack of approval, the taunting, and the kind of making fun of what I was doing, as opposed to support and saying, yeah, good job, Lily, you're allergic to these foods, you're not eating them anymore, great, 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 great. Instead, it was like, hypochondria, it's like, oh, now you're ruining the meal, that type of attitude. And so we need to have a great mindset and say, what's more important to us? Is it to please people by the way I eat, or is it to please my body by the way I eat? So I get what you're saying, and I think we need to look deeper into that, Dr. Levy. So as I know, so take us through what happens to that food for 8 hours in the gut, or 9 hours in the gut, or 16 hours in the gut. Does it become putrefied, and that the toxins come directly from the food being in the intestines? How does that backfire on us?
Precisely. The longer food stays in the digestive tract, the less gets properly digested and the more rots and putrefies.
Mm-hmm.
Okay, so for lack of a more elegant way of putting it, the longer the food is there, the greater the opportunity what pathogens you have to come in and proliferate rather than be processed by the good bacteria. So it's, maybe a good analogy, I suppose, is if you throw a piece of meat on the sidewalk out in the sun and pick it up 15 minutes later, it's still fine. Pick it up three hours later and you have a stinking putrid mess. Okay, so same thing. Things are not designed to sit in your gut indefinitely. There are definitely optimal, what's called bowel transit times. And like I said, I think a lot of people that think about it at all think about the gut in different sections. Don't think about it in different sections. It's continuous. Okay, so if it's slow up front, it's slow in the middle, and it's slow below. You speed things up front, you speed things, everything else. And the natural state of digestion is really to pass food completely through your GI tract, no more than 12 to 14 hours. Some people more rapidly, but probably 12 to 14 hours. And people who, let's say, work at home and they have their desk and their bathroom is 3 feet away. When you have your bathroom available to you and you're doing things correctly, you'll find that almost like the baby, you'll have a bowel movement of some degree, roughly the frequency with which you eat. Just like the baby, eat, poop, eat, poop. Adults do that too, if they're eating correctly, if they're combining correctly, and if they have the accessibility. So we can suppress desires. So why I use the home environment, because if you're in an office filled with people and there's one bathroom, and a lot of times you just want to wait till you get home. You don't even want to use the facilities except for, say, number one or something like that. All of that impacts it, okay? But people who are motivated to find this out will find that the frequency can come very close to basically the frequency with which you have a substantive ingestion of food. Is about how often you'll have some degree of a bowel movement. If everything's working correctly, and if bowel transit time is correctly, and if a poor food combination is not just shutting things down.
This is instead of saying mind blowing, I'm going to say mind glowing, because right now I'm just like, my brain is like lit up. And so as I'm visualizing this food sitting in my stomach and putrefying and creating all sorts of symptoms, that I don't take medication other than the stuff that I've had to take, which I am trying to get, like thyroid condition that I started before I learned this. But when I was rear-ended in 2017, 4 herniated discs, concussion, spinal compression, left torn shoulder, I never took a pill. And those are the things that I've learned since then, that there's other ways that you can manage pain. There's other ways that you can do things. So when I'm seeing that, and I'm visualizing this putrefaction, this toxicity starting in one place in my body. So how does that lead? How does it lead to dis-ease? So how do people are able to eat like horrible their whole life, and they seem to be okay, but as they get older and older and older, then they're shocked why they have diabetes, or they're shocked why they have other issues. But if we start looking and visualizing our body sooner as opposed to later, what are some of the diseases that could come from just digestion problems?
Again, any disease. I mean, we've talked about whatever facilitates the release of toxins and pathogenic bacteria through a leaky gut, which is all associated with this, into your lymph, into your blood. They'll promote anything. You know, in addition to how a meal feels after you eat it, is bowel movements shouldn't be just incredibly disgustingly stinky. They should be off-putting, okay? And I'm sure we've all had the friend or guest or something that's come over to the house, gone into our bathroom, and nobody can go in there for 2 hours. It's almost like it sticks to the walls. Okay, so that's poor digestion.
Yes,
that's a predominance of putrefaction. I mean, let's just put it out there straight. Your bowel movement shouldn't smell like Correct. A rodent that went inside your gut. It disintegrated, it died, it rotted. And that's
I know what you mean. Your diet, your body is constantly whispering to us. But when you get to that point where, and that's been in my past, that I can identify with that. You're going, what animal died inside of me, you know, and how can I get this thing out? And that happened to me when I had food poisoning. Oh my goodness. And so that was many, many, many years ago in my 20s or 30s. But as I've entered my 58th year, you know, I know a little bit more about the body. But when your body is sending you stink bombs like that, you better listen before you get burned. So let's talk a little bit about that. So you notice that there is a foul smell. That's not normal.
Never normal. That's why I use the word off-putting. I mean, there should never be a bowel movement that smells good. That's why I say off-putting. Okay, but but if a family member is digesting correctly and goes to the bathroom and does everything, the bathroom should be fine in 5 minutes.
Yeah.
Not an hour or 2 or 3 later. Okay, so that's the simple, inelegant point to be made.
I love it because I know you're making people's head glow right now. So go ahead.
Well, you know, and this is one of the reasons, really switch gears a moment here, why the hydrogen peroxide nebulization is so good.
Okay.
What causes all disease and what sustains all disease is the continued ingestion of pro-oxidants, which means toxins, which means bacterial byproducts, etc., because they oxidize, they take electrons away. That's all disease is how many biomolecules, protein, enzyme, sugar inside your cells get oxidized, because when they get oxidized, they don't work anymore. Okay, that's the disease. Oxidation doesn't cause disease, it is the disease. It seems like a small point, but it's a big point. You see everything in the literature as well. High oxidative stress leads to disease. Well, no. Your Parkinson's, your Alzheimer's, your fibromyalgia, that's not something in addition to a unique array of biomolecules that are oxidized. That is the disease. So what keeps guts abnormal, in addition to not following good food combining, is a continued ingestion of toxins and poisons, which are oxidizing agents. Once again, I want to reemphasize, you can't have any disease unless you have an ongoing source of new oxidation. And that ongoing source of new oxidation for the gut is coming from swallowing pathogens and toxins that are coating your nose and throat and pharynx, okay? Not necessarily in the setting of a cold. A cold sometime in the past might have set this up, but it covers with biofilms. And unless you have something that strips away the biofilm, you'll keep that for life. You'll literally keep it for life until you come in, strip away the biofilm, kill the pathogens, and then stop spilling the stuff into the gut 24/7. And antibiotics cannot do it.
Correct.
Cannot do it. That's the important point. So with the peroxide nebulization, which we've talked about at some length, this very quickly clears out the nose and throat of these pathogens. And in many people, myself, a bunch of friends, patients who have given me feedback, very quickly, gut problems that have been present for years start resolving. And by resolving, I mean disappearing. Okay. The other good point about this is the way that the gut is really toxic is the toxicity of the gut, abnormal microbiome promoted by this. You also have the leaky gut, which allows it to get throughout the body. And the important point to be made there is the intestinal cells lining the gut that give the barrier to keep these negative toxins and pathogens from crossing is made up of cells that have a half-life of 3 to 5 days. So you basically have a new intestinal lining every week. So for people who have what's called chronic leaky gut, they really don't have chronic leaky gut. They have chronic acutely induced leaky gut. And the chronic induction of the toxins that you swallow repoison, reoxidize the new generation of intestinal cells over and over and over again. And it looks like a chronic disease. And for all intents and purposes, if that's the way your gut has been working for 3 years, it's chronic. But it's not a chronic disease in the sense of what's causing it. It's an acutely inflicted disease on every new generation of cells that you turn over and generate. So, and that's why people see results, many people, I don't want to make too broad a generalizations, why many people see such a rapid resolution, diarrhea, constipation. I haven't had the feedback yet, positive or negative, but it's perfectly logical as well that people with gluten sensitivity, food allergies, fatal peanut allergies, all of that should be expected to disappear. Now, some of the allergies, the nature of the immune system, they might hang on a little bit longer before they completely resolve, but you should see the results of stopping the leakage of these abnormal substances in the blood very quickly.
Okay, so are you saying, and by the way, if you want to learn the true roadmap to health, I've got some great news for you with Dr. Levy. Dr. Thomas Levy has agreed to do a workshop for all of us There is a cost to it. So you can go to my website at whenyouneedafriend.com and check out. It's on Saturday, February 6th. It's about 6 hours, right, Dr. Levy? We're going to start.
Sunday, February 6th?
I'm sorry, Sunday.
Yeah.
Sunday, you're absolutely right. Sunday, February 6th. And it's going to be Zoom. So for people all over the world, if you want to start empowering yourself, you may want to go to whenyouneedafriend.com. While you're there, please become a subscriber, because that is the only way. Like right now, for those of you who are subscribers and you want to learn more about Dr. Levy, maybe this is the first time that you've heard of him, you can go to your blog that you got on Sunday, click on his name, and it'll take you to peakenergy.com. It'll take you there. It'll give you information, maybe some of the other videos that we've had Dr. Levy on. And also if you go to whenyouneedafriend.com, in my New Truth series, because these are all new truths. We've been lied to. And the people that have lied to us unintentionally, but the people that started the lie, that was the purpose, to get us to dis-ease. I mean, we think about all the animals out there that are wild. There's not a lot of disease out there, is there? You get killed by a bigger animal. But in the for people that are more evolved, here we are, we're dying of these diseases. And you don't see your pets doing that until now. We're seeing our pets dying of the same diseases that we have because we're feeding them improperly. So I just, if you want to take your life back, become your own MD, your own medical detective, so that you can listen intuitively to your body, then you may want to take this course with Dr. Levy. And I hope that these courses turn into more courses, because all this information should not be in this one man. It should be in all of us, so that we can start sharing these new truths. So go to whenyouneedafriend.com. Again, subscribe, like, and follow all my social media. Do the same thing for Dr. Thomas Levy, and then sign up or click on the link to find out a little bit more. We just began this process, so we're still kind of getting that page up and running. But if you have any questions about it, but it's going to be 6 hours with Dr. Thomas Levy, Q&A, all the listening to the information that he has learned through the years that we can partake in, we can take advantage of, we can start verifying it on our own body, so that we can start living an optimal health. I love the fact, Dr. Thomas Levy, I'm so, MDJD, by the way, so glad that you're doing this for us. And the fact that we can get you for that amount of time and we can ask questions is invaluable. Thank you.
Well, I've had a lot of people in the past say, are you going to put on any seminars? Are you going to teach any of this? So I finally had enough requests that I said, I guess I better. And I'm certainly convinced enough of the validity of what I have to say. And the fact that, without being judgmental, I don't find many other physicians that seem to even know most of the things I'm talking about, is in addition to my books, because if you put all of my books together, there's some 13 of them out there now, you can harvest the picture for yourself. But it's probably a whole lot easier to come to this seminar and get kick-started, and then whatever really piques your interest, there are any of a number of my books that go into those things more deeply, because, nobody's roadmap is the same. Nobody's roadmap is the same.
No, one size does not fit all.
Just like people say, how much vitamin C should I take? And I say, well, I don't know, how many oxidized biomolecules do you have in your body that you need to repair vitamin C and reduce? It's different. Everybody's disease. I mean, tit for tat. If you have, let's use a silly measurement. If you have 10 pounds of oxidation, well, then you need 10 pounds of antioxidation to repair. If you just have a little bit. So some people will feel fabulous on 1 or 2 grams of vitamin C a day. Others will feel fabulous on 9 or 10. Mm-hmm, mm-hmm. And that's where we get back to what we talked about earlier, the health intuition. Mm-hmm. You'll really start to understand what your optimal amount of vitamin C or any other supplement is when you start reaching this high level of intuition. And then more importantly, on days where you start to lose it, you don't feel sick, but you no longer feel perfect. Mm-hmm. And that's when you start to experiment, trial and error with what works best for you in dosing your supplements and how you take them. And of course, other considerations like your diet.
Yeah. I want to remind all of you, the first time, second time, and actually the first and second time that Dr. Levy was in the classroom, we had so many questions that we just didn't know, because the algorithms are messing with us on Facebook and YouTube. So I'm not getting some of your questions. So that's why I asked to if I haven't asked your question, you can text me at 407-373-5959. And at least I know that I have your questions. But we had so many people ask about the nebulizer and how do you use it? So the third time Dr. Levy came on, he answered all your questions. So I want to encourage you to go back. I think I'm going to start a playlist just for Dr. Thomas Levy, because there's so much information packed that I didn't even know. So I want to go back to the hydrogen peroxide and the nebulizer and how it helps balance out that gut health. When you were talking originally, when you talked about it, it was about the virus that's out there. And you shared a story of South America, and there's really no money in these poor clinics, and you had shared your protocol, and all of them got well. And some of these people were really, really sick, from mild to very extreme, and all of them got well. The protocol you shared was, and I don't know if I'm saying this correctly, but it was 30 minutes, 3 times a day with a hydrogen peroxide, 3% hydrogen peroxide. Right. People can dilute it if they want to do it. But that was too much for me, because I just wanted to try it. For me, it was like 1 second, not second, 1 second, 1 or 2 minutes.
However, if you had advanced COVID and were severely short of breath, it might not have been too much for you.
No, I'm talking. That's
exactly.
Why
I'm just saying sensitivities vary on how sick you are at the time.
Yeah. So that was a great barometer. That was a great understanding of a protocol by Dr. Thomas Levy. So when somebody has gut issues, what would that protocol look like for some people? Like, we have to tweak it. For me, it was like, I just need very little because I'm healthy, but still there are things in my body that I want to tweak. So in a situation when we want to work on our gut, what would you say would be a healthy protocol to get those biomolecules kind of like turned over so that we can start feeling that gut health?
Well, again, not surprisingly, it's not one size fits all.
Correct.
And just like with dosing vitamin C and how you feel.
Correct.
In this particular circumstance, it's doing some nebulization and seeing if your gut settles down in any way. Okay. I repeated this story many times now, but this is the perfect time to repeat it, which is when I first started nebulizing hydrogen peroxide some 2.5, 3 years ago, while I was doing the research for a magnesium book, I always had horrible allergies, frequent coughs, frequent colds, and I'm sure I was colonized like crazy. Well, after nebulizing 100 different combinations, I decided to just nebulize peroxide by itself. Okay. And I did it, I don't know, 10 or 15 minutes in the early evening. And the next morning, now I'm like 68 years old at the time. Okay, so I've spent my time in the bathroom. And it was bizarre. My eyes popped wide open. Something was happening that had never happened before in my life. I had the most incredible, continuous, well-formed bowel movement in my life.
You know, you're getting older.
and it was unlike anything I had ever experienced in my life. combined with the fact, and I think a lot of people don't like to talk about this, but it's cleansing. Usually toilet tissue smears things around. In this case, there was nothing to wipe off. It was just nothing there, which also meant there was a different constituency to the bacteria in the stool, etc.
Yeah.
And what I suddenly realized after I finally got over this stunning event, and that's what it was stunning, is I said, well, why did that happen? And then I said, my God, the hydrogen peroxide. I said, and then it just all started cavalcading down as a, duh, you talk about disease being caused by oxidation. You talk about pathogens causing oxidation. Well, the gut gets oxidized too. And if you stop swallowing pathogen, the gut heals. I didn't even realize about how quickly the cells turn over at the time. That's something else I came along. But it became very apparent. And in my situation, and I can only say this for myself, I was able to determine my best frequency of nebulization by how perfect my bowel movements were.
Wow.
And if I stopped doing it for 3 or 4 days, then they wouldn't be awful, but they'd be less perfect. Then I start nebulizing again, back to perfect. So I think, some people never get colds. So a lot of this is going to be overkill for them if they have an immune system and their physiology is so perfect in their head and neck that they just never get bothered with colds, never have allergies, this, that, or the other. They're going to have to seek out what's best for them. And it might be nebulizing only when they develop a symptom, or maybe 2 or 3 minutes once a week. Okay, so all of that needs to be worked out on an individual basis, but just keep in mind that what you're doing is you're trying to keep a good normal flora in your head and neck, sustaining as normal a bowel movement and as minimal a digestive or gut symptoms as you can. Gut symptoms, gas, bloating, diarrhea, constipation, you name it. And you look at the drugstores, they have several aisles just filled with stuff to help some digestive system feel better. So it has to be an individualized type thing, and I just can't give a generalized
that's good
recommendation.
That's good.
Yeah.
Everybody needs to follow their intuition. Again, go to whenyounneedafriend.com, click on New Truth series and click on workshops, and the Roadmap to Health workshop is there. I believe Robert has clicked on the link and he's shared the link with all of you. Share it with your friends. You owe it to yourself to get to know your body and be able to address it naturally. And that Roadmap to Health is a one-day workshop. It's a virtual workshop on Sunday, February 6th, 2022. And so it's on Zoom. There is an early registration pricing right now. So take advantage of the early registration prices and start living the life of your dreams. We only have about a minute and a half left, Dr. Levy. Who should come to this workshop? Who is it, just for doctors or is it for anybody?
Well, truth be known, a lot of doctors, except for the few humble ones out there, would just feel like they don't want to waste their time listening to something that might be directed at the general public. Well, truth be known is I give pretty much the same presentations to the public as I do to the doctors, and they seem to be equally well received. The doctors just seem to be determined to continue to think themselves intellectually superior to everybody else. So it's suited for everybody. And for a physician who just wants to learn some information on this, obviously people can participate anonymously. It's not like being in on a Zoom call. You're in an audience of people and they can see who you are. You can block out your video, whatever you want. So you can utilize this for whatever education means you need, and you can utilize it anonymously, but it's designed for anybody, this is anybody, is just about everybody, I might add, designed for anybody who is not getting the results they want in dealing with whatever conditions they have. That's probably the best way to put it.
I love it. I love it. And for those of you who want to learn more, go to whenyouneedafriend.com. You can also go to peakenergy.com, check out our websites, both Dr. Levy's and mine. And Robert, I don't know if you're sharing right now, because I don't hear anything. There we go. Now we go. I guess I was ahead. Now we're going to continue our conversation with Dr. Levy. He's going to answer your questions. And so for those of you who have questions, now the time, just type in your Q's and we'll address them in the Teacher's Pet Corner. And for those of you who are listening on podcast, just know you can always get the entire broadcast when you go to BitChute, Odyssey, Facebook, and YouTube. And please remember, we'll be right here waiting for you worldwide at whenyouneedafriend.com. This is Lillian McDermott and Dr. Thomas Levy wishing you love, peace, joy, and unexpected abundance. Make it the best day ever. Good job. Good job.
The opinions and advice expressed on the Lillian McDermott radio show are intended for the individual callers and guests on the program and are presented to our wider audience solely for general educational purposes. Please act responsibly and consult personally with your own medical, psychological, or nutritional expert before taking any steps to improve your life.
Okay, Dr. Levy, we got some questions here. This is just such important conversation to have. And the fact that you're empowering others, all of us, to know this information, that is so gratifying to be a part of this. And I want to thank you for including the Lillian McDermott radio show classroom as you're sharing this information out there. So I'm excited to be a part of it. Thank you. Okay, so we do have some questions, and I also have some others that I have for you. Okay, so we have a question says, I have advanced heart disease post 2 open heart surgeries, a CARB-G and AVR. Now the mitral valve is in severe regurgitation. Yeah. No surgery is possible because of scar tissue and calcification. I am currently on a vegan diet and want to know if I will buy some time, if I can buy some time. Clearly, I'm end stage. What kind of hope do you have for him or them?
Well, it depends on if they're dealing with a certain number of symptoms, or if they're feeling fairly well, but knowing that the condition in the heart is continuing to evolve. I mean, all these things I talk about make non-specific symptoms better. The headache, the arthritis, the fatigue, the energy level, you name it. So, but it's not going to reverse a severely leaking heart valve. Now, some of the things that we talk about, the supplement wise, do dissolve calcium deposits. They mentioned that there's calcium involved in that. I can't tell you how much dissolving some of that calcium might make the valve work a little bit better. Can't say. But basically, we're just talking about doing the things that you would do at any stage of your life to give your body optimal nutrition and give it its opportunity, its best opportunity to do whatever healing is possible.
Can I ask a question for this person? How much dental work would you suggest for someone in their condition? Would you say it's time to work backwards and say, what's going on in the mouth that could be causing the problem in the heart, or is it too late?
No, the thing too is, again, you have a leaking mitral valve. Now, sometimes a mitral valve can leak a certain degree and it will just stay at that degree and not worsen. And although it will cause some problems, it doesn't necessarily, in and of itself, take a lot of time off of your longevity. In that particular case, since this individual also indicated they had coronary artery bypass grafting, they had coronary artery disease, we've talked about this earlier. And my contention, based on the literature, based on what I've seen, and based on the things we've talked about and discussed in the book Hidden Epidemic, is that 100% of traditional coronary atherosclerosis, developing the blockages until they start to block the blood vessels off, is caused by chronic pathogen colonization from the mouth, setting up shop inside the coronary artery, using up all the antioxidants, including vitamin C, acute inflammation, comes in, and the inflammatory response just continues to promote the development of atherosclerosis. So I go through that long-winded explanation to say, if you have a couple root canals or one root canal, or your 3D cone beam examination shows you have a few other infected teeth, getting those extracted can potentially stop the progression of any further coronary artery disease, possibly regress some, but certainly, depending on how your mitral valve is, your mitral valve might not be the thing that takes your life. It could be another heart attack that takes your life. So in that regard, if you can stop the coronary atherosclerosis progression, you can do a great deal of good for your long-term health.
Great. That's really good. And I just saw the name. I didn't have my magnifying glass. It's Anne. So thank you, Anne, for asking that question. If you have any more questions, please continue to ask. So Myrna asked, could cauliflower rice with beans work? We need our rice and beans, Doctor.
Actually, it's been a long time since I've boned up on food combining, but I actually think that could be a good combination or an acceptable combination. So,
yeah.
And that brings out a wonderful point. Use your mind, be inventive, think of things. There's a lot of wonderful things out there to eat, but we just fall into these habits of it has to be this, it has to be this, it has to be this. But I think that could be an excellent combination. Yes.
What about quinoa? Quinoa is protein as well. I just
I don't know.
Okay. So Barbara asks, how much hydrogen peroxide do you use in the nebulizer? And do you need to add anything else with it? I want to encourage you, Barbara. I'm going to start a playlist for Dr. Levy. Well, no, I can't, because many of his classes have been deleted from YouTube. Isn't that sad? So maybe on BitChute, you can go on BitChute. I don't know if I can do a playlist, but just find it on my site, or I'll see what I can do. You know what, Dr. Levy, what I'm going to do is I'm going to take all your classes and I'm going to put it in. So for people who watch it, when they click onto the roadmap to health, they'll all be there. So you can go to whenyouneedafriend.com and then click on your the New Truth series, and then go to workshops, and there it is, roadmap to health. We'll make sure that by the end, well, I don't want to say Robert is going to do this, but so pretty soon they'll all be there. So there should be 4 or 5 classes we've done together, right, Dr. Levy?
Maybe this is the 4th. I'm not sure.
Yeah, one or the other,
Yeah.
but at least they'll all be there. That way you can click on them. Okay, so can you answer? Would you like to answer real quick so that Barbara knows a little bit more about? I don't have my nebulizer.
I forgot the question. We went a major tangent there. So,
how much hydrogen peroxide do you use in the nebulizer, and do you need to add anything else with it?
No, for the purposes of dealing with pathogens in the nose and throat, you just need the peroxide. And amount, I mean, it's not so much the amount of peroxide as how long you want to nebulize. And, some peroxide chambers some nebulization chambers are 4 cc, 6 cc's, 8 cc's. It doesn't matter. You continue to add peroxide until you've nebulized for the period of time that you want to nebulize. So it's and for everybody seems to have, understandably, I suppose, some misgivings about doing anything for the first time. Just go to YouTube, type in how to nebulize, and you'll see a horde of wonderful. And you'll see very quickly, it's not rocket science. It's simple. You have a little air pump connected by a tube to a little chamber that you put the liquid in, and then comes out of that and then goes into the mask. And it's very, very simple, very, very straightforward, and nothing to be anxious about. I mean, most of you have seen, I'm sure, maybe just in movies or something, you've seen little kids or people in the hospital and they're inhaling nebulized medication. Same thing.
Very good. Very good. Okay. So let's see. There was another supplementation. So we talked about changing the way that that we're eating our food. Let's say, for example, let's say we become mono, what did you call it? Mono what?
I forget. Mono meal, mono eating.
Mono eating. Okay. Yeah. Okay. So we're just eating one thing at a time. Or
well, I'm not necessarily saying you have to do that. I'm just saying that's your best way of assuring that your food combination, that you're not being impaired by an inappropriate food combination.
Yeah. Yes. Yeah. So with that in mind, are there certain supplements that you suggest to aid that? Or, I mean, I really do believe that we have the power to control our outcome in life, right? And that everything can be reversed, and have that hope that things can be reversed. But there's a lot of people out there that think that they're using that pill, that magical pill, like they're using the supplement, and they're not doing what they need to do. But let's say, are there supplements that are good for you?
The best supplements that I know of and that I would recommend is foundational supplements. In other words, if you have a limited budget, which most people have, the 5 supplements you should make sure that you take are magnesium, vitamin C, vitamin D, vitamin K2, and another supplement called Formula 216, which appears to help most people to increase their vitamin C levels by supporting vitamin C synthesis in their liver, which most people are naturally depleted of. So those 5 things together are an enormous benefit. The first 4, well, all 5 of them, each one separately is associated with decreased all-cause mortality. In other words, each one taken by itself decreases your chance of death from anything. And that's because each one of them favorably impacts calcium levels inside your cell. The higher calcium levels go, the sicker and more oxidized the cell is. Magnesium directly pulls those levels down. Vitamin C going into the cell does the same thing. Vitamin K2 and vitamin D help dissolve calcium deposits throughout the body. And the Formula 216 is another source of vitamin C. So it has the same impact as supplementing vitamin C, except that if you're in the group that responds, which so far it appears most people respond, you continue to make vitamin C even when you're not supplementing it.
Really? I didn't know that the human body could produce vitamin C.
Well, there's a lot of information on the site. The site is formula216.com.
Formula216.com. Okay. I think that's good. It's
actually, in my opinion, probably the single most significant supplement ever discovered.
Really? I'll have to check it out. I've never heard of that. I'll have to check it out. So, okay. Anything that you want to share before we go? And regarding the workshop, and are you excited about the workshop, by the way?
Yeah, I mean, I have a lot I need to do between now and then, so I'm not even really thinking too hard on it right now, but I'll put my nose to the grind wheel probably about a week or so before it starts and put everything together. So aside from which, and this may sound crazy, even at this state of my medical career, my life, everything else, I know there's going to be some interesting points that I know in 2 months that I don't know now.
Correct.
I mean, it just continues to pour in, which is, kind of exciting, because I think, what did they say? Somebody who enjoys what they do for a living never works a day in his life.
Correct.
Something like that.
Yeah.
And that's the case with me. I mean, a lot of times a friend will call me, they'll say, well, what you doing? I said, well, I'm writing an article, or I'm reading a book. I said, oh man, we got to go do something for fun. I said, what do you mean? I'm having fun right now. I said, if you want me to take a break and we'll go out to dinner, fine, but I'm not torturing myself right now. I'm enjoying what I'm doing.
I get it. No, so again, Sunday, write this date in your calendar, protect it with your life, because your life depends on it. We've got to inform ourselves. We've got to get out of this white coat trance. We've got to, we've got to make sense and be more intuitive. There's a reason why God gave us intuition. There is a reason. And so mark the calendar, Sunday, February 6, 2022. We're going to have the first workshop with Dr. Thomas Levy. It's a virtual Zoom workshop. And so check out the website, go to whenyounneedafriend.com. I believe Robert put the link on there, so you can just click on look at the comment section. It should be somewhere in there. And I'll also put it in the description once we post it, because I think this was pretty good. I think we could post this one on YouTube. I'm hoping we can post this. So I'm not asking any controversial questions. So, but just understand, there's a lot of information that we don't know. And it shouldn't all be inside of Dr. Thomas Levy's head. We should acquire it for ourselves, so that we can go through our Rolodex when our intuition says, something is wrong here. Oh, I've got a headache. Well, what did I learn? Okay, I can hydrate myself. I can eat a meal, whatever it is that your body is telling you to do. Now you can trust your body. But when you've been hacked, it's really hard to trust anything. So again, it's called Roadmap to Health. This is how to alleviate pain and symptoms with Dr. Thomas Levy. And there's an early registration, and I can't remember how long early registration is, but it could be in the website. But check it out, sign up, register, and let's start. Let's pack your bags and get on this roadmap to help. Dr. Levy, any final words?
Yeah, and take your virtual flight.
It'll be really, really inexpensive to get your virtual tickets for this wonderful workshop. I'm really excited to be a part of it. So thank you, Dr. Levy, for always giving us hope that there is a different way, a new way, and an only way to achieve optimal health. So thank you.
Our pleasure, Lily.
Okay, we'll see you guys soon. We'll see you guys